Good morning for our colleagues in the US. My name is Oteba Olo Martin, and I'm the Deputy Chief of Party of the Uganda Health Supply Chain project, which has brought us together today. And this particular occasion is for us to celebrate our 6 years of strengthening pharmaceutical systems in Uganda. Among us are prominent people, key speakers, as well as our panels and listeners across the world. We have a 1.5 hours meeting, during which we shall be showcasing and discussing the achievements of the Uganda Health Supply Chain, a 6-year project that has been focused, as I've said, on strengthening pharmaceutical systems in Uganda. It is a USAID-funded project. It had nationwide coverage, and there are quite a lot of achievements that we have registered, as you will see in a few minutes using the video, and as our colleagues who have been at the forefront of implementation or beneficiaries will tell us. Just quickly to let you know that we have the director of the Uganda USAID mission. I will introduce him later. We have the Honorable Minister of Health, Dr. Ruth Aceng, the two of whom will be key speakers. We also have other key members of the Ministry of Health, key staff of the Ministry of Health, directors and the commissioners, who are also listening in. We have among our listeners staff of the USAID mission, as well as MSH colleagues across the globe and at the Home Office. Among the prominent members, we have the CEO and the President of MSH, Miriam Wentworth, who will give us a closing remark later. And then after that, we shall have questions coming from the audience. And please, you will be posting your questions through the YouTube chat, and that will be visible for us here. So as partners and colleagues present, please take note of the questions or comments you have. So with that, I want to welcome everyone. Thank you very much for logging in, for appreciating our call. Please enjoy this occasion. Thank you very much. I now take this opportunity to welcome our keynote speakers, the Honorable Minister, Dr. Jean Ruth Aceng, and the USAID Mission Director, Mr. Richard Nelson. You're welcome. Richard Nelson is the director of USAID's 10th largest mission overseas, and oversees the health sector, where he also, which portfolio includes HIV, AIDS, TB, malaria, reproductive health, infectious diseases. He also looks at economic growth, education, democracy and governance, and humanitarian programs within the mission. Before coming to Uganda, Richard Nelson was the deputy director for the US government's Power Africa initiative based in South Africa, supporting US government agencies and companies working on expanding power throughout sub-Saharan Africa. Richard was a USAID legal officer in Pretoria, Bangkok, Baghdad, and Washington before his stint with Power Africa. Prior to joining USAID as a foreign service officer, Richard worked at Dell Inc. in Austin, Texas, where he helped lead their global site selection efforts. He was the vice president of Wachovia Securities in Charlotte, North Carolina, before that. As an investment banker, he managed a $1 billion portfolio of syndicate credit facilities in the aerospace, health, and government contracting sectors. And before then, he was an attorney with McGurry Woods, a national law firm, where he primarily worked on capital markets debt transactions. Richard is a graduate of law from Harvard Law School, and as well as arts, Bachelor of Arts in Brigham Young University. He is married and has 3 children. Richard, as you can see, is a very experienced, broadly multi-skilled, and we have him as a mission director in Uganda, and we are pleased to say he is doing a good job despite being here for a short time. I take this opportunity, Richard, to welcome you, and please make your remarks.
Thank you very much, Martin. I appreciate that introduction. Honorable Minister, CEO of MSH, other government officials who are attending, partners and friends, I am very happy, very pleased to be with you today on this webinar to celebrate the achievements and the results of the USAID Uganda supply chain activity. As Martin mentioned, I've only been in the country for a little while now, about 6 months, and most of that time has been spent in a lockdown situation. But I have been able to learn a lot just within that 6 months about the great variety of activities that USAID is involved in. And among the most important of those is our health activities. And within those activities, this supply chain program has been very critical, especially as we've seen in this COVID situation, the supply of commodities is paramount. And we've been pleased to be a part of the partnership with the Ugandan government in helping to set that up. Over the years, the US government, through USAID and the President's Emergency Plan for AIDS, PEPFAR, has partnered with the government of Uganda to strengthen the national health systems through various investments, including technical assistance to the Ministry of Health Pharmacy Department, the National Drug Authority, and the National Medical Stores. Today, we want to highlight the incredible life-saving advances made by this partnership through our Uganda Health Supply Chain Project, which was implemented by our partner, Management Sciences for Health. When the project was launched in 2014, we set a clear goal to improve the health of all Ugandans by making essential medicines and health supplies more available, more accessible, and more affordable to all. The US government invested about $39 million through this project to make sure that Ugandans have uninterrupted service and access to medicines and medical supplies. And while the project has had many achievements in improving the Ugandan health system, I'll just point out a few of the more important ones. Overall, USAID strengthened regulation, oversight, and monitoring of the supply chain system. And between 2014 and 2020, we helped the Ministry of Health develop 8 new policies, including the National Medicine Policy and a policy on equity of allocation of funding to essential medicines based on the level of need. As a result of these policies, the government of Uganda is now funding medicines and health supplies not only for the public sector, but also for the private sector through joint medical stores to make services available for more people. Consequently, this year, the Ugandan government is allocating $3.4 million to the private sector for this purpose. That's up from $2.8 million in the previous year. Through the program, we also helped set up the Quantification and Procurement Planning Unit in the Ministry of Health's Pharmacy Department. This team of highly qualified and experienced public health logistics professionals makes sure that the country has uninterrupted supplies of medicines and medical supplies. As a result, 1.25 million, or 85% of the approximately 1.48 million people living with HIV, have received life-saving treatment made possible with these commodities. That's in addition to many other Ugandans who are suffering from malaria, TB, and other diseases, who are now getting the health commodities that they need as well. To respond to health facilities' lack of adequate storage space for medicines, in collaboration with the Ministry of Health's Pharmacy Department and the AIDS Control Program, this supply chain program supported the installation of 26 prefabricated storage units in high-volume sites in 22 districts. We also helped Uganda to be better prepared for disease outbreaks and epidemics through an electronic emergency logistics management and information system that helps with coordination, information flow, commodity planning, and visibility in public health emergencies. So when COVID-19 hit earlier this year, Uganda didn't have to start from scratch in its response to the pandemic. It already had an infrastructure in place. The COVID-19 emergency response system now covers all 135 districts, 15 regional referral hospitals, and 2 national hospitals, which is actually quite amazing given that we've been dealing with this for such a short time. So in summary, as a result of USAID's support through this project between 2015 and 2020, the stock of available medicines and medical supplies grew from 65% to 81%. And 1,537 public health staff have been trained on improving the accountability and management of health supply chain activities. This means that more medicine and medical supplies have reached and continue to reach pharmacies, hospitals, and health centers all over Uganda. We've seen improvement in the prevention and treatment of HIV/AIDS, tuberculosis, and malaria, and it's strengthened laboratory services as well. It has also enabled more expectant mothers, newborns, children, and adolescents to be overall healthier. So through these efforts and our partnership with the Ministry of Health, we have contributed significantly to improving the quality of life of the Ugandan people. I want to congratulate the government of Uganda, and especially the Ministry of Health, the health workers, and the partners who are involved in this for all of your outstanding work. We look forward to continuing to work side by side with the Ugandan people in supporting your long-term health development goals and aspirations. So thank you very much, and I look forward to the rest of the program.
Thank you very much, Richard Nelson, the Director, the USAID Mission to Uganda. We now go to our next keynote speaker, who is the Honorable Minister of Health, Dr. Jane Ruth Aceng. But to introduce the Honorable Minister, Dr. Jane Ruth Aceng is the Minister of Health, Uganda. As the Minister of Health, she possesses the constitutional powers and function of spearheading the ministry. Among them are administration, policy, formulation, and direction. She is also responsible for defending the ministerial budget and issue orders and statutory regulations on the sector. In addition, she initiates and presents to Cabinet the ministry memoranda and accounts for state operations, functions, and achievements of the health sector. She holds a bachelor's degree in medicine, a master of medicine in pediatrics, and a master's in public health and a diploma in health system strengthening. She is a pediatrician expert and is currently at the level of senior consultant pediatrics. She's also a public health expert. Dr. Aceng has a vast experience, both as a manager and practicing medical practitioner, which she accumulated while serving in various capacities as medical officer, senior medical officer special grade, medical superintendent, consultant pediatrician, senior consultant pediatrician, hospital director, and formerly as the Director General Health Services, where she was responsible for coordinating technical functions for delivery of health services, a role she fulfilled until her appointment as the Minister of Health. You can see the wealth of experience and expertise that we have been so lucky to have an honorable minister with all that at the back of her professionalism, and therefore, no doubt, she's steering the ministry in the right direction. Honorable Minister of Health, we invite you to make your statements.
Dr. Martin.
Yes, welcome, Director, Dr. Olaro. You're welcome.
Yes, because I keep getting muted and then I can't be able to speak. So the USAID mission director, Richard Nelson, the USAID Uganda mission staff, the president and the CEO of MSH, the chief of party, Uganda Health System Strengthening Project, the MS Global and other global participants, all those who are joining in this YouTube, the development partners, implementing partners, district representative colleagues, ladies and gentlemen. I bring apologies from the Honorable Minister who could not be able to join in this meeting, so he extends our apologies, but he sends warm regards to the USAID Mission Director and his team. So on behalf of the government of Uganda and on my own behalf, permit me now to read the speech of the Honorable Minister. I want to thank the United States government for the strong partnership and the mutual engagement with the health sector, and in particular in the pharmaceutical sector over the last 30 years. As Ugandan government, we appreciate the huge investment by the USAID in various programs and projects across the country, and I'm honored that the Uganda health sector is one of the major beneficiaries of this partnership. Allow me to extend our most profound gratitude to the people of the United States of America for their generosity, to the Ugandan people. Your investment in strengthening our public health supply chain systems has set up in a journey to a sustainable, robust health supply chain system, which are aimed at national commodity security, facilitating uninterrupted supply of medicines and medical supplies to the people of Uganda, and attainment of the national medicine policy. The government of Uganda has a long-standing commitment to ensuring a universal access to good quality, affordable, essential medicines and health supplies at all times, and promoting their appropriate use. The minister has strived to make this a reality despite emerging and re-emerging challenges with HIV/AIDS, the outbreaks that continue to escalate the burden of disease and the health situation in the country. Over the first 5 years, we have worked constructively together to address the constraints that affect the public health supply chain to ensure a long-term, sustainable accountability and a transparent system. I'm proud to share that we have achieved the tangible results through our work together with USAID and the Uganda Health Supply Chain Project and the Department of Pharmaceuticals and Natural Medicines in the Ministry of Health has been critical to achieving these results. Some of the key highlights include the development and implementation of policies and guidelines to strengthen the pharmaceutical sector, to improve the health outcomes, and this includes the National Medicine Policy, which was developed in 2015, and the Pharmaceutical Sector Strategic Plan 2015-2020, the Standard operating procedure to organize the essential medicines and health supplies manual and the Uganda clinical guidelines of 2016. As you note, definitely the pharmaceutical sector strategic plan has ended, so we need to develop a new one. And also we should have developed a new Uganda clinical guidelines. We have instituted measures to avert stockouts and expiry of drugs by empowering the lower health centers to quantify and order medicines based on their specific needs. This is in preparation of or the rollout of ordering-based system at lower health centers. We have also invested in building a resilient and responsive public health emergency supply chain. This investment alone has made Uganda better prepared to respond to outbreaks like now the COVID-19, the EVD outbreak, the yellow fever, and others. We have worked together to determine the emergency national commodity needs of COVID and developed and functionalized the electronic emergency logistics system. We have also established the quantification and procurement units in the Ministry of Health, the Pharmacy Department, and this has enabled coordination, data-driven decision-making, and optimized financial resources to ensure uninterrupted supply of medicine and medicine commodities. We have established and functionalized numerous electronic logistic management information systems, such as the pharmaceutical information portal, the RX solution, the web-based ARV medicines ordering and reporting systems, and the tuberculosis medicines web-based ordering systems that stakeholders use to better manage health commodities and also track and detect problems. This has enabled us to enhance data generation, availability, and access to logistic data that's critical for evidence-based decision-making for service delivery. We have scaled up Ugandan response HIV, which has been boosted by infrastructure development in expansion of medicine stores in 26 high-volume facilities and trading of health facilities and training of health workers to manage the HIV commodities. The ministry also has established essential medicine and health supply credit line of United States $2 million in public funds for 534 private not-for-profit health facilities, which are managed through the joint medical stores, a more cost-effective and transparent procurement mechanism for essential medicines and health supplies, which are dispensed at the private not-for-profit facilities. We have also developed a supervision assessment recognition strategy, better known as SPAS, which is a tool for performance quality improvement. That has led to facilitate improvement in the inventory management and support supervision at health facility, and thanks to the work of the supervisors and the district leaders who have supported this system. And we have also made significant gains in the management through expansion of SPAS from focusing on essential medicines to building health worker skill in managing tuberculosis, HIV, and laboratory pharmaceutical products. Further to that, we have facilitated the establishment of quality systems that ensure quality assured medicines are continuously available and counterfeits are eliminated, which has resulted into accreditation and certification of 101 public and private facilities not for profit, which are certified in pharmacy good practices, and 484 wholesale pharmacies which have been accredited. We have been also working with various partners. The Ministry of Health has developed tools and procedures to ensure availability and accountability of medicines. So as you look through all those ones, those are really quite numerous, and the effects definitely are multiple, which the health system has been able. So today, as we look back with a sense of satisfaction on the contribution made by 100 people in the health facility districts and other institutions, we are privileged to have worked with the UHSC to implement these interventions. The Ministry of Health would like to assure the American people of our commitment to fast-track the journey to self-reliance as a means of sustainability, and will always build the success of this project to continue to partner with the USAID government and other development partners and other donors to further strengthen the health sector. I congratulate the team upon this successful getting the newly awarded USAID-funded supply chain project, and I think we still strongly believe this will bolster their efforts. I want to thank the management of the Science for Health Development Partners, the Ministry of Health team, district leaders, and health workers for all their efforts in working the success of this project and partnering to deliver evidence that supports a transformative and a sustainable health supply chain. I've delivered all this on behalf of the Minister of Health for God and my country.
Thank you very much, Director Dr. Laro Charles. Ladies and gentlemen, you may be looking at the list of people who are on the screen. Those are mainly participants who are going to present and talk to us. The bulk of the population is on YouTube. The bulk of the population is on YouTube, and please, people who are watching through the YouTube, who might have joined in late, please do take notes and prepare your questions and post to the chat, YouTube chat. There is a team who will be sharing this with the panelists, and your questions will be answered. Thank you very much. We now head to the next part of our meeting today. That is the session of panel discussions. I would like to introduce the panelists. We have 3 panelists who are largely colleagues who have been beneficiaries of the UHSC work. We have Dr. Francis Odeke, who is the District Health Officer, Serere District. And Dr. Francis Odeke is the District Health Officer, and his role is to manage and coordinate the effective, efficient, and affordable delivery of quality health services. He has been in this position since October 2010. His other positions have included Principal Medical Officer in Soroti Municipal Council, Senior Medical Officer, Soroti Regional Referral Hospital, Medical Officer, Mental Health, Mengo Hospital, Mulago, and Jinja Referral Hospitals, National Trainer in Malaria, IMCI, TB Management. His academic qualifications include a Master's in Public Health from Parma University in Italy, postgraduate diploma in research methodologies in reproductive health in Geneva, Master of Medicine in Medicine from Havana University, diploma in orthopedics from Mulago Paramedical Institute, and a certificate in tropical medicine from Pedro Cure Institute in Havana. I will introduce all the speakers so that we don't interrupt them. Our next speaker will be Pamela Achi, a health products management specialist from Ministry of Health, and also the Vice President of the Uganda Pharmaceutical Society, who will be talking on the supply chain in relation to HIV/AIDS response. Pamela, as I've worked with the Ministry of Health under the Global Fund as health products management specialist responsible for coordination and management of the Global Fund, and the government of Uganda health products for HIV, malaria, TB in the public sector. She also the Vice President of the Pharmaceutical Society of Uganda. Pamela joined the Ministry of Health under USAID MSH-led program in 2012 and later transitioned to UHSC until 2018 when she joined the Global Fund at the Ministry of Health. While at MSH, Pamela was seconded to the Quantification and Procurement Planning Unit, a centralized unit in the Pharmacy Department of the Ministry of Health, to coordinate quantification activities for vertical programs such as HIV, AIDS, malaria, and TB, including RMNCH. Pamela's academic qualifications include a bachelor's degree in pharmacy and a master's degree in public health, both from Makerere University. Our third speaker is Mr. Paul Mbaka. Mr. Paul Mbaka is the head of the Division of Health Information in the Ministry of Health. In this role, he coordinates and guides the implementation of the Uganda e-health health information as well as health knowledge management policies and strategies in Uganda's health sector. Paul is a statistician, software and database developer, M&E specialist, epidemiology and disease surveillance specialist. Prior to joining the Ministry of Health, Paul coordinated the African Health Observatory and real-time strategic information systems in the World Health Organization. He has worked as senior monitoring and evaluation officer with the Ministry of Finance, Planning and Economic Development, and as an M&E specialist, statistics and database with the World Food Programme. He holds a Bachelor's of Statistics degree, Master of Statistics, and certification in monitoring and evaluation, burden of disease estimate, and project planning and management. In his free time, Paul enjoys writing poetry, playing chess, and basketball. So we have a poet and a basketball player before us. Paul, we welcome you. Pamela, welcome you. And Dr. Deke, we welcome you. So Dr. Deke, I will give you the floor first to give us what your experience has been with the Uganda health supply chain. And for that, I have a few questions for you, which we would request you to answer if you don't mind. So Dr. Deke, if maybe we shall go to the next speaker as you prepare, so that we save time. Our next speaker was planned to be Dr. Pamela Key. Thank you very much for joining us, and I welcome you once more to this gathering. I appreciate the fact that you've given us this time. And my first question to you, what effective approaches has the Minister of Health employed to address supply chain challenges in the HIV/AIDS response?
Yes, thank you very much, Martin, for inviting this event. Good afternoon, Uganda. Good morning, Washington. I'll just go straight to the experiences I have seen in the addressing supply chain challenges and how ministry handles this in response. So the first thing that we do as Uganda, like many African countries, is that we work on the WHO recommendation as really a basic yardstick that we reference as our guiding policy document that the Ministry of Health uses to develop national treatment guidelines. These national treatment guidelines are tailored to the country context and then disseminated to the health facilities to understand the guideline, and then it is then implemented by health facilities. So this is one of the approaches the ministry has taken. The second one is very important that many other panelists have already alluded to, the keynote speakers, is the establishment of the centralized quantification unit, commonly known as the QPPU, here in Uganda. This unit is responsible for forecasting, supply planning, ordering, monitoring stock status for health supply chain for HIV/AIDS commodities in Uganda. The unit is established within the Ministry of Health, and currently it has played a very important role, especially in driving adoption of treatment recommendation. For example, the recent rollout of dolutegravir-based regimen, that the QPPU really has to guide the country on when to actually roll this treatment guidelines. So it has been very helpful for ministry in this aspect. The third approach that the ministry has employed is having centralized the warehousing mechanism. Previously, before 2012, we had various implementing partners that were actually doing mini quantification and procurement of health commodities. And with this, there was no visibility into exactly how much, for example, Ministry of Health is spending on health commodities. So the warehousing mechanism was centralized to the national medical store that would support the public sector. The joint medical store and medical access then support the private sector, and also the private not-for-profit sector. So with this alignment, it was very easy to track and monitor the movement of health commodities across health facilities, but also to avoid double dipping where you have warehouses colliding in one specific health facilities. And this has worked very well for the Ministry of Health. The next is what we call the distribution system. We work with our national medical store, which is a public that currently help us to monitor the distribution of health commodities, and have also deployed what we call delivery monitoring tracking tool. This tool really helps you to see what products have been delivered at health facility, who has received this product, and when they received it. And we think that this is a very important mechanism that helps us to receive notification, but also to confirm that actually NMS is playing its role. The other is the electronic logistics management information system. I must say that HIV/AIDS was the main driver of this mechanism by setting up what we call the web-based ARV ordering system way back in 2012. And this system really provides visibility to patient regimen, stock status, but also health facilities to be able to place orders and to National Medical Store, and then NMS uses this information to replenish orders for facilities. I must also say that this web-based system is accessible to all the 3 warehouses, not just NMS, but Joint Medical Store and Medical Access at the same time. And we are working with an organized delivery mechanism for medicine, which is a bi-monthly cycle known to all facilities, and the delivery schedule is also well established and well published sites to all health facilities. So it is really known information. And this has helped us to improve the supply chain for HIV/AIDS commodities. We are also looking at the HR that with support from the Uganda Health Supply Chain, we had a number of support provided to districts in terms of medicines monitoring supervisors that have helped us to monitor the status of health commodities in districts. And these also have helped us to really try to respond to some of the challenges that we were facing in district and other health facilities. And finally, we are having a very significant contribution in terms of increased government of Uganda commitment towards the procurement of HIV/AIDS medicine. I recall in 2012, the GOU contribution was about 80 billion Uganda shillings for ARVs. And as I speak now, this has actually increased to 150 billion Uganda shillings. And this is basically due to demonstrated funding gap analysis, but also coming from the quantification exercise that is done to actually see that, well, government needs to put in more funding, and government has done this very well. Of course, what also contribute to this is the contribution from the other partners, such as the Global Fund and also the US government through PEPFAR, that also provide more funding for health commodities. So these have really significantly helped Uganda to avert many of the challenges that we have actually faced. And as I speak now, really, status for her medicines. Thank you, Martin.
Yes, thank you very much, Pamela, for that. I now have a follow-on question, which if you could answer in about a minute, because we are running out of time. And the question is, how can a supply chain system in developing world context meet demands of the ever-changing ARV treatment guidelines? Over to you.
Yes, thank you very much, Martin, for that question. 2 things can do. One is data visibility is very important to actually inform planning. We need information on patient regimens, on the stock status at the facility level. And this, if you have it, then it is a very tool to actually plan and forecast your demand supply. The second is pharmacovigilance. Of course, we are using very new formulations that we need to monitor. So a very strong pharmacovigilance system that allow for reporting of adverse events is very important. And Ministry of Health Uganda is really moving very well with the National Drug Authority to actually do this. Thank you.
Thank you, Pamela, for those insights. And thank you once again for availing yourself to this audience. We'll be having questions. I guess I can see quite a number of questions already, but you're welcome. Thank you very much. Dr. Odeke, are you now there? Dr. Odeke, do you hear me?
Well, I hear you, yes, clear.
Thank you very much. You're welcome, Dr. Odeke. I had already introduced you before, and I hope you had.
Oh, yes, I did hear. Thank you very much for that kind introduction.
So I have some 2-3 questions for you.
Oh, yes.
The first one, briefly describe how supply chain performance at district level has changed over the 5 years with support from the USAID Uganda Health Supply Chain Program in your district.
Well, Martin, I want to thank you so much, and Ministry of Health, USAID, and Uganda Health Supply Chain. I hope I'm clear.
Yes, you are. Yes, you are.
Well, thank you. Now, Martin, I want to say this has been a very tremendous Uganda health supply chain on a number of areas. Basically, the district had a number of gaps before we entered into a partnership with Uganda Health Supply Chain. There was no obvious supervision structure as far as medicines and supplies were concerned. There were issues of transport, lack of transport, and of course, infrastructure was missing or lacking, and then the capacity gaps in knowledge. Now, when we joined the Uganda Health Supply Chain, we had a number of gains. First of all, the supervision structure was put in place, and particularly in Serere, we have 2 health sub-districts, and of course, the bringing on up of the medical medicines supervisors, 1 for each health sub-district, and the district medical medicine supervisor was a very, very important step, which brought us a lot of improvement in supervision of medicines and supplies in the district. And the supervision of medicines and supplies means that we have enough quantities, they don't expire, we can redistribute them, and we know where there are more medicines and where they are needed. Now, we had a lot of support from Uganda Health Supply Chain. For example, supervision. Supervision was supported on a monthly basis to visit all the facilities and visit their stores and see the stocks that are available. And once our medical medicine supervisors and the district medical medicine supervisors perform and bring their reports 100%, the DHO also benefits from that through airtime and MBs for his diligence in making sure that those 2 or 3 officers produce results which are wanted. Well, again, Serere also benefited from prefabricated stores. Among the very few districts in the Teso sub-region, I think it is only Serere that received a prefabricated store, which is actually based in Serere Center 4, one of our high-volume facilities. And we were very, very happy that our medicines are now well taken care of. We were in space, well aerated, and you know where which medicine is, which one is first expiry, first out, which one is in place and in excess. Well, the training of medical medicine supervisors in the supply chain was the other achievement. Those ones who even lacked pharmaceutical knowledge and had no background now are now champions in the supply chain and ordering of medicines, where we don't have excesses, we don't have shortages, and of course, what the health supply chain gave us is a lot that we really feel we really deserved. Each one of them has got a motorcycle, brand new, and all the riding gear, the gloves, the helmet, and the riding suits, which is very rare in most of the organizations or implementing partners or donors per se. And again, these people were taken for training. Is one of the areas, one of the places where for you to go there for training, it costs a lot of money. And that took place for all our 3 medical medicine supervisors who are trained. Apart from those, we had also additional laboratory SPAS officer, and then this TB and leprosy supervisor under SPAS. Those ones also were taken to Garuga for training. And that was very interesting because everybody who came from there said now they are experts. They want to go and do the chasing, the competition. I said, no, that's not your duty. You are only taken there for training so that when you come back, you don't get accidents. And I feel that was really very interesting and very nice for us. Again, the capacity gaps under continued mentorship, the supervision, the monthly supervision and quarterly supervision by health supply chain was the other. It was really good, and it kept us on our toes to see to it that we produce the best results. I thought, Martin, that is what I could mention for what we had before and during the coming of Uganda health supply chain into Serere District. We were very, very privileged and very grateful.
Thank you, Dr. Deke, but I still have two more questions for you.
Okay,
and
fine.
the second question, and I would request that you put on your video so that the audience globally see who is talking.
Okay.
Yeah, the second question is, what plans do you have to sustain the gains made under the UHSC program?
Well, we have a number of course, plans. One is the staff we have, district local government staff. So they are already there until they retire. But we are going in others so that in case anything happens, if they want to go for greener pastures, we have a number of people who have been trained on medical medicine supervision. The other one is the assets we have received, the motorcycles, the computers, the modems, the riding gear, the helmets and things like that. The stores, for example, the pallets, the shelves are a state of the art in our district, actually in our region. And we are very happy with that. We are going to make sure that we maintain them, make sure that for the motorcycles, they are well maintained and they do not get, of course, spoiled. For the infrastructure, the prefabricated store will definitely be looked after very well to make sure that they do not get cracks or they do not get wasted. So that is what we think we can continue. Integration of activities, monitoring and supervision of medicines and supplies should be integrated. And we are going to see to it that we integrate those activities into the routine activities so that everybody who goes to the field knows what is needed and what is lacking. And of course, the budgets, the departmental budgets, actually, we are going to integrate the departmental budgets into the supervision part of it. And then, of course, with the work plans. And then, of course, we have to see to it that lobby from other partners. We already have TASO that is here working with us, but we need more partners to come and share with us. Maybe a partner that will come specifically for TB spas, for lab spas, or for something like that, so that we see. Good enough, we already have results-based financing in our facilities. And of course, results-based financing, it is the PIP, that is the performance improvement plans that matter where you are going to inject your money so that you attract more clients, especially if the facilities are having medicines all the time. So we are going to see what percentage of this RBF money we are going to put into the supervision part of the medicines. The assets we have, I've already mentioned that we are going to maintain and make sure that we use them very well. Martin, thank you.
Thank you, Dr. Deke. And just in one statement,
Yes.
based on your experience, what advice would you give your colleagues from other districts to improve their supply chain performance?
Well, my advice to my colleagues is, first of all, to stop being desk officers. We should get out of our desks. We should go to the field and see and supervise our medicines and supplies to see to it that which medicines are excesses, which medicines are in short supply, so that we is handled. We should also demand for periodic reports and discuss those reports as an opportunity for improvement, say through monthly meetings. For me in Serere, we have the district medical medicine supervisor always joins the DHT to brief us the state of the medicine, which medicines are in short supply, which medicines are lacking, especially the HIV/AIDS medicines, the TB medicines, and the rest. That is what we definitely have to hear from the district medical medicine supervisor. And I would advise my colleagues to liaise with them, to take them like colleagues and friends, and also give them incentives and recognize them as performers, good performers, by giving them airtime, by giving them MBs, and recognize them during public and public gatherings like facility recognition, or during meetings, World AIDS Day, World Women's Day, if she's a woman, for example, so that we get good knowledge and impact from them. We should also lead the supply chain activities, including redistribution, to minimization of management of expiries, you following the guidelines from Ministry of Health, first in, first out, first expiry, first out. Those are things which they should put into consideration, and look out for any resources to support the supply chain management. Actually, supply chain management should actually be a duty of all clinical officers and clinicians, because they are the ones who know which medicines are necessary, which medicines are used quite often, so that they know which quantities is going to be requested or ordered. To liaise with the other organizations so that they come to our rescue in case there is a shortage. Thank you very much, Martin.
Thank you, Dr. Deke, and we are grateful that you agreed to at short notice to present yourself and your district with regard to your experience to supply chain management,
Yes.
the experience of UHSC.
Martin,
And
I want
finally,
to tell you something. Martin, I want to tell you something, by the way.
We are bad off in time, in terms of time.
No, this is very important. You know, Serere district was the best district in 1819 league table. And I definitely owe this to a health supply chain.
Thank you very much. Thank you.
Not recognized us. Thank you.
Thank you very much, Dr. Deke. You recognize you kept flying around in the Ministry of Health as screens. Thank you very much.
Thank you.
Ladies and gentlemen, our next speaker is Mr. Paul Mbaka. I have already introduced him before. And Mr. Paul Mbaka, if you are there, please welcome, present to us the information management systems. Welcome.
Thank you very much.
We have 10 minutes.
So I should just present, no questions asked?
No, questions will come, but you have 10 minutes to present.
Okay, thank you very much. I will quickly just give the situation, the current situation of supply chain data availability and visibility in Uganda. As you know, in terms of digitizing supply chain systems and ensuring availability of data, we have over the last 5 or so years revolutionized this process. But like most Ugandans like to say, we basically have a long way to go. We've set up systems right from inventory management in clinical settings using systems like RX solution. We have set up ordering systems, the famous one being the HIV ordering system, but there are those for TB, logistics as well. We have other systems for managing emergency logistics, and these have been highlighted before. And also we have certain ordering systems that are embedded within some of the electronic medical record systems that we have. We've also implemented some visualization tools that ride on some of these very robust data warehouses like the pharmaceutical information portal, but we also have the drug dash that we, among others, that we've developed. Of course, the RAS. Not to paint a very good picture, we've also had some challenges, uncoordinated investment being one that is very critical to highlight, with risks around wastage. We've had an epidemic of naming, where we have one system, but different modules almost standing out as if they were systems of their own. An example being our ordering system, where we have the HIV, TB, and laboratory ordering components being treated as if they were independent systems. But also there have been leadership challenges, and of course this one here is really something that the Ministry of Health needs to strengthen. The leadership role of the Ministry of Health has not come out very strongly in this regard. Of course, to implement these data and digital systems, we would generally rely on a robust ICT infrastructure. Our investments in infrastructure has not been very strong, and this has somehow affected us. Just to highlight some of the things that we have to do, I've already highlighted a bit of the fact that we've implemented already some warehouses like the PIP, some data warehouses like the PIP, but we would like to connect these to robust analytical engines that can provide us some information products to enable decision support as policy formulation. As we look into the future, we should be looking at interoperability of systems. We need systems that deal with supply chains, but also integrate with clinical systems so that you can generally link what you see in terms of case numbers and dispensing at health facility level with your delivery forecasts and your ordering, so that these are linked end to end. In the future, as we develop, of course, our next year 5-year strategy, we are looking more at systems that, of course, are interoperable, like I've mentioned, systems that are more integrated. We've had very many little implementations of systems here and there. We would like to have integrated systems. We would like to be better at packaging information for decision makers, embedding things like notifications. I know we already have some notifications for some of the systems that we have, but we have not been we have not been packaging these notifications for decisions. So you generally do not want to bombard the decision maker with every sort of notification you can possibly provide, but one that might be able to trigger a decision. Of course, I know we've been doing commodity forecasting and some of these other cool things, but in the future, we are looking at leveraging on some of this cutting edge technology, such as artificial intelligence, predictive analytics, among others, to ensure that we are more responsive. As you know, we are still dogged with a bit of overstock, understock, and if we could make our prediction and forecasts a little more robust, we may as well help with this. Ownership at subnational and national level is very important. We've struggled with some of these systems when sometimes the districts may look at it as a top-down implementation, and yet we would like ownership really where the implementation takes place. Also, we need to move more into enriching some of the information products that we have with better analytics and visualization, including leveraging on geographical information systems. A case in point being when you need to redistribute stock where there is overstock in one place and a shortage in another, GPS can help you find the most optimal place to enable your redistribution. Thank you very much. Over to you, Chair.
Thank you, Paul. Thank you, Paul, for that. You covered even what I would have asked you subsequently, and that is very good. All right, I have here are 3 questions from people who have posted. And the first one is, what needs to be done to accelerate the move from manual systems to electronic systems? This is for you, Mr. Paul Mbaka.
Thank you very much, Chair. This is a very important question, and most especially at this time. Our current health sector development plan, as one of the key shifts highlighted in this document, is the need to move digital. And we are currently developing a digital health strategy, digital and health information strategy for Uganda, which also focuses on moving from paper to digital tools. What is important, what we need to do is, first of all, to be deliberate. As I speak now, we are already in advanced stages of implementing complete digital tools at regional referral hospitals. Of course, this involves a significant investment in infrastructure. We've had to set up networks in these regional referrals, but we've also had to buy computers for all service points in this regional referral. So we've just started rolling out in some of them, and we hope by maybe mid next year, we will be done with regional referral and start focusing on general hospitals and cascade downwards to health center 4 and the others. So really, to answer this question, of course, we need significant investments in infrastructure, change management, and so on. But the only thing we need to do to be able to achieve this is to be deliberate. And this is something that we've not done. We need to all focus, let's be on the same ship and move together rather than the current piecemeal investments that we've done. Thank you.
And Pamela, Dr. Pamela Chi, you have also a question here. How can Uganda sustain HIV treatment gains achieved to date?
Thank you very much, Martin, and the question that have been posed. This question is very important. It is a sector-wide question in terms of the responsibility of the health sector, but also the very people that we serve to contribute to sustaining these gains that we have actually achieved. But one of the things that we can do as the Ministry of Health, but also as the professionals, is something that I already hinted on: pharmacovigilance. As you have seen that before the introduction of DTG, very many of our patients already were very stable on treatment. Issues of stigma, had reduced, but also patients had stabilized to a very large extent. And then when we introduced this new and wonderful formulation, definitely was a very good formulation. There were issues around, adverse events that actually was interfering with the acceptability of this formulation. And this would have a ripple effect in the sense that very many patients would distance themselves from this treatment, but may also abandon the medicine. So as health professionals, but also specifically pharmacists, I think we need to strengthen our pharmacovigilance in terms of picking the adverse events very quickly and managing them very quickly, but also reassuring the patients and making sure that they continue to be safe so that they continue to take this medicine for the rest of their lives. So I think this is one of the ways that we can actually sustain the gains we have already achieved as far as the HIV/AIDS treatment is concerned. Thank you.
Thank you very much. We have more questions. The next one, which may be relating to you, since you are still holding the mic. The question is, what are your suggestions to sustainability of the supply chain interventions at district level?
Thank you, Martin, also for that question. Yes, one of the ways that we can really sustain the and look at sustainability of supply chain at the district level is is making sure that we actually have the position of the district pharmacist formalized within the structure of the Ministry of Health, but also service structure, so that we can have this pharmacist who is actually funded by the government of Uganda to be able to perform the supply chain within the district. This is how I really think we can sustain the function of the supply chain at the district. And we know that the role of this person would be very important in terms of, one, making sure that facilities actually place orders. That is very important. The other is redistribution of medicine. Paul has alluded to the fact that sometimes we have overstock of commodities, sometimes we have stock out. Some of these problems can be solved at the district level even before asking for replenishment of stock. And we think that at that district could actually play. I think that the position of the district pharmacies is something I will continue to emphasize. But I also know that the Ministry of Health has already appreciated this. And this also came out in the recent National Supply Chain Assessment. So as we go into the pharmaceutical sector review of the policy, and I believe that this would be something that the Ministry of Health will really advance and make it actually happen. And once that happens, I believe that the supply chain future, especially at the distant facility level, will be very bright. Thank you, Martin.
We have two questions here which are common and similar, and they relate to, is there a follow-on project, so to say? And the answer is yes, the USAID has offered a new follow-on mechanism to MSH, and I want to congratulate ourselves on that, and we are still at a startup point. It has quite significant difference from UHSC, and so given the time we have, I cannot go so much in the detail, but there is a new mechanism. Having said that, for those whose questions we may have not answered, please bear with us. Time is not our ally in this respect, and I want to take this advantage now, first to say that all this was made possible by good leadership. This good leadership starts all the way from the head office of MSH through to the project leadership. From the head office, we have Marian Wentworth, President and CEO, Management Sciences for Health, who is going to give us closing remarks. But before she comes in, I want to take this advantage, first of all, to thank my local lead, who is Philip Kamtenga, who is there on the wall listening, and to inform you that all this has been made possible by his able and very wonderful leadership. And having said that, I now pass the mic to you, Marian.
Thank you, Martin. You hear me?
Yes, we hear you. We hear you.
Excellent. I'm a little nervous when the segue that you use to transition starts with leadership. That means the expectations are high. To members of the ministry, members of the USAID mission, some very distinguished and knowledgeable panelists, the UHSC team, and all the supporters of the UHSC project. As Martin said, my name is Marian Wentworth. I am President and CEO of Management Sciences for Health. And I have to say that this particular event is personal for me because when I began working at MSH 3 years ago, my first visit, about week 7, I believe, on the job, was to visit the Honorable Minister and to see the work of UHSC in Uganda. And I can say that the only thing more beautiful than the Ugandan country is the Ugandan people. And so the work we do in this fine country is extraordinarily important to me personally. Management Sciences for Health has been a partner of the government of Uganda for longer than I've been at MSH, for 2 decades. And we have a shared goal: longer and healthier lives for the people of Uganda. And we've worked together hard to figure out how to make that happen. And we've accomplished a lot. Over the years, MSH has supported Uganda health managers in improving their leadership skills, in finding, diagnosing, treating HIV and TB patients faster and better. We have trained local NGOs on human resource management, information systems, performance-based financing, and most recently, of course, on supply chain management. I want to echo a bit the remarks of the speakers before me. Over the past 6 years, the Uganda health supply chain has made a much greater number of safe, essential medicines and medicine supplies available to pharmacies, hospitals, and health centers, and enabling more mothers, children, and adolescents to get life-saving medication when and where they need them. And we have also helped strengthen the laboratory system. Now more than ever, this work is crucial, as the mission director remarked. As the world fights COVID-19, Uganda's investments in its health system and in its leadership and its agility are showing results. Projects such as UHSC have helped Uganda better respond to the pandemic. Uganda did the hard work of building those systems to ensure uninterrupted supply of medicines and health commodities, and now it can more quickly determine and fulfill emergency commodity needs during this crisis. Of course, we have room for much more progress, and as I listen to the comments that have been made by the other speakers, one of my tests for how much we've learned is our ability to be critical about what we have not yet learned and ambitious about what we want to learn next. I'm glad together that we can actually work together to look forward to the future. We are starting another project with the US government partners and with the health ministry to further strengthen Ugandan's health supply chain. The project will improve the availability of and access to safe, quality assured medicines and health supplies in public and private nonprofit health facilities. And our work will help promote transparent leadership and effective data-informed policies and regulations. We will have a special focus this time on strengthening local capacity to promote self-reliance in managing a world-class supply chain. In implementing the project, MSH will partner with Uganda Health Federation and Advocates Coalition for Development and Environment. These collaborators will gradually take on more technical and management responsibilities, which means greater local ownership and sustainability. On behalf of all of us at MSH, I am grateful for the opportunity to continue our work as a trusted supply chain advisor to the government of Uganda and USAID. This project will further strengthen the health system to more effectively combat infectious and non-communicable diseases and improve health services and outcomes for all of Uganda's families and communities. So congratulations and thank you. Over to you, Martin.
Thank you very much, Marian, for those beautiful words. I want to thank the Honorable Minister, the representative of the Honorable Minister, the Director, USAID Mission Uganda, Richard Nelson, our distinguished panelists, our distinguished participants and listeners across the globe for really having given us this 1.5 hours. We don't take it for granted. That is an indication of how much you love us, how much you've been following what we do. And we are glad to receive any comments of improvement or advice or questions that you may have. And we are willing to definitely share where we have really achieved, because we are doing this for humanity and not for Uganda alone. Thank you very much. And with this, have a nice evening and good morning to the rest of the people in the US.